and again, it comes to a little bit of personalization, is show that you really, again, it's got to come from the heart, that you really care, that what's your intent. um and there's different ways of showing that, and what I mean by that is that you don't have to be a doctor or a nurse, although that's always nice, if that's a member of your particular team, but it doesn't have to be that way. But you need to be able to show some level of empathy, that you understand this is patient care, that there's individuals that, depending on what you're selling or the service, that their life may depend on that. And so show some sort of understanding that you're not just selling. Like, I'm going to give you an example. Let's just take cybersecurity. So one of my companies I work with is a cybersecurity firm. And so what I've taught with them is like, yeah, you sell cyber into multiple industries, and for a lot of them, it's pretty black and white. But this is healthcare. And we've made implicit promise to our patients from a CIO perspective that we're going to not only give them the best quality care, but we're going to treat their data with ultimate confidentiality. So you, as a vendor coming in for cybersecurity, you better understand that and be able to articulate that same statement. It's like, yeah, of course, got these bells and whistles. And we know that at the end of this is patient information, the most sensitive information that people have. And we're going to do everything in our power. That's what drives us. That sort of thinking, Grant. And there's ways. I'm sorry if I go long, but I want to be
No,
practical.
no, keep going.
There's ways to get this. And I'm telling you, the response, again, it cannot be manipulation. So that's sometimes I'm hesitant to share these things, because I don't want anyone to do it out of because they were trying to manipulate a situation, but I want it to come from the heart. But this way that I'm going to suggest also can help develop that heart, and that is volunteer. Volunteer. I say this for CIOs and people who work as providers, but as a vendor, volunteer. Go to your local hospital and say, look, I've got 1 hour a week. I'll bring my kid with me. So don't tell me you can't do it because of family. I took my kids with me. And it was a great experience for our kids. So volunteer 1 hour a week and just see patients. And then when you talk now to the prospect, you're talking to the CIO, you can say, I get it. I understand it. It's not much, but I do spend an hour a week, and I stand with, I walk around on the floor where they do outpatient chemo, and I talk to the patients and I talk to the clinicians, and I get it. And it's changed me, and I'm passionate about this. And that's a game changer, Grant. So those are three broad areas. Went really specific into the last one because I think it kind of covers the first two as well.
No, those are sage advice for anyone, especially if you're working